Hi, my name is Matthew Cook, and as Chair of the National Aboriginal Community Controlled Health Organisation, I welcome you to our Aboriginal Health and Aboriginal Hands for Healthy Futures video series. We'll be taking you on a journey around Australia to visit member services in rural, remote and urban communities. Our 150 Aboriginal Community Controlled Health organisations deliver culturally appropriate, comprehensive primary health care at 302 sites nationally to over 300,000 Aboriginal people each year. Before we start out, let me give you our definition of Aboriginal health. Aboriginal health means not just the physical well-being of an individual, but refers to the social, emotional and cultural well-being of the whole community in which each individual is able to achieve their full potential. It is a whole-of-life view and includes a cyclical concept of life, death, life. As you will see in this episode, our organisations work because they give Aboriginal people ownership of their own health at a local community level. It is our communities that have a holistic understanding of what can improve health outcomes within their communities. Our Aboriginal Community Controlled Health organisations have been successfully providing healthcare to Aboriginal people for more than 40 years, and in this series we will be interviewing board members, CEOs, doctors, Aboriginal health workers and community members. They will be sharing their stories about the challenges they face, what works best for their community, and most importantly, their achievements. Our Aboriginal Community Controlled Health organisations provide stable and meaningful jobs in rural, remote and urban communities. They are the largest employer of Aboriginal people, larger than the mining industry or any government department. Our member services comprise over 5,800 staff, of which 3,200 are Aboriginal and Torres Strait Islanders. These dedicated individuals in our Aboriginal Community Controlled Health organisations will share how they are improving the health and well-being of our people.
You know, Redfern has a very good and a vibrant community, but it's not just a community here of Redfern. We go all over New South Wales, and in actual fact, when there are national conferences on or national sports events or whatever, people come here and they always make their way to check out the medical service. So it's a community of Australia-wide, I suppose. It's the Indigenous community of this country. If people in Redfern are not well, then Aboriginal people right throughout Australia are not well. And if people aren't well in Perth or in Townsville or Hobart, then we're not well. So Aboriginal people have got to start looking after and seeing ourselves as the total community of Indigenous Australia. Each medical services, over 200 I believe at the moment, interact with each other so we all know how and what each other are doing. The board of an Aboriginal organisation, and that's any, but in particular health, because there's so much pressure on being on a board of an Aboriginal health service. You're competing against hospitals, you're competing against Medicare locals, you're competing against all the other Aboriginal health dollars as an Aboriginal medical service. So you come under that microscope. One of the biggest challenges is being there and having a look about your priorities here. Now, ministers, state and federal, might have a priority about this and that, and they'll put the dollars for this and that. But I mean, in actual fact, the priority that the board sets has got to be one that takes into account the local health needs and the local health issues. That's what self-determination is all about, and that's what we're all on about, self-determination, and of course, with that comes all the other issues. But you've got to know what you're tackling, what the priority is. Sometimes a minister, state or federal, health minister, they have their flavour of the month. So diabetes might be the flavour of the month. So every medical service then is expected to go out and do this, that and the other in diabetes. Drugs might become a big issue when in actual fact for us it'd be alcohol. So you've just got to manage and massage those sort of situations where you say, here's the priority and here's what we be looking at fixing. And that way then, that's what community control and self-determination is all about. When we first started hiring doctors here in Redfern, we used to take them down, all the applicants that we were going to interview, we would take them around Redfern and take them to the riverbanks and show them this and that and the other. And we used to say to them, this is where your patients are coming from. So the doctors themselves had an idea exactly what they were treating. It wasn't just somebody coming in here with a cut foot or, a bandaged arm or something like that. It was somebody that came from a house that was overcrowded. It was somebody that come from a house where violence was there involved. So they knew exactly what to expect. And I think that's why we had a lot of doctors that were here for quite some time. And see, the other thing is that it's the staff. And a lot of our staff are Aboriginal. And some of them, it's the first job and only job they've ever had after leaving school. And some have been here for 36 years, some for 30 years and all that. It's the one and only job they've had. So people get to know, the patients and clients get to know who that person is. And the other thing is, see, we had no Aboriginal doctors when Redfern first started. And I think there's something like now 165, 170 Aboriginal doctors throughout Australia. I mean, it's a great thing. Not all of it, of course, is because of Aboriginal medical services, but I think a lot of it is. A lot of Aboriginal people continue to come back and use Aboriginal medical services, not just here, but I think all over, because they get to know the staff, they get to know the doctors, and they just get to know, if you come here with a cut foot, then yes, they'll look at the cut foot, but health workers will also ask, would you like this check? Would you like a blood check? Would you like this and that and the other? Is there anything else bothering you? So you have a holistic approach to that person, not just the individual in their cut, but indeed the whole community. So if that person's got, it's come from a household that may have something going on there, then you can go and treat that whole household.
We try and meet the community needs. So they don't want big flash, programs, but they want programs that are going to work. I don't understand why I can't keep the young well all through their life span, as opposed to, I've got to wait for them to be diagnosed. There's so many restrictions and restraints within the resource that we're given. And it's a very small resource as well. Our policies are derived from Canberra. And that creates issues with the way that I manage, because sometimes I don't see that, an issue in the Northern Territory, in a remote community, may not be one of my issues locally and in an urban setting. I came in originally as the Chief of Staff, and I acted as a change manager because the board were wanting to review their programs and bring it all through to the 21st century, which was their mandate, and which I've taken that solely as my brief. We've endured quite a number of challenges along the way. As any organisation undergoes change, it's quite an upheaval. I only asked that once I started the change management, that we didn't stop. We had to keep going. And that they have done. Really the board's belief, because they're the ones that are, they're the experts of what's needed in the community. And I think that's one of the things that, we overlook as an asset and as an advantage to community control. I'm just the catalyst in all this, and what their beliefs are and values, I try and embed that in our new way forward. Prevention is going to be a big component, and I want people to lose weight, to become more active. If we can just contain those two elements, we're least likely then to move on and get a chronic disease. We're seeing about 1,500 occasions of service across the organisation, and that would be conservatively stated. We're also seeing a high percentage of new registrations as well. You'll find that sometimes people will trick to Redfern merely to see our doctors, and they know that we're going to look after them. That dedication. I'm looking for people that are dedicated, dedicated to the movement, dedicated to Aboriginal people. All the main diseases that we're more likely to suffer from, we've got the specialists to come on campus. And that makes it easier as well. And people are more likely to turn up for their appointments, and they're trusting us that these people are going to provide them with the best care possible. And I think that's part and parcel of an AMS. We run a surfing program in the summertime. We have 20 kids and they turn up 8 o'clock in the morning. And because we give them breakfast because they were starving before lunch. And I said, I know it takes it out of you. So their parents just love seeing the photos and to see the kids being able to stand up on a surfboard. They achieved something and they loved it, just their little faces. And, we don't write anything about that, or we don't tell anyone about those achievements, because no one wants to know about it because no one funds it. Because, we've got Aboriginal people managing the needs of the Aboriginal people. So, and that makes the difference.
I think like all communities, there's issues with diabetes, high blood pressure. Smoking's a big thing. Just the general things that affect, everyone in urban populations. When someone comes in and they stop smoking, that's, always a big, plus for my day. And you think that's something I can do that's going to affect their whole life, for the benefit. And not just them, their family. The other thing I find is people seem to be a little less likely to come to the doctor, so they'll put things off because they don't want to bother people, and they'll come in when they're really sick rather than some people would come in. There's often two types of patients: those that come in when they don't really need to, and those that don't come in when they need to until they really have to. So it's often a challenge when people come in and you think, why didn't you come a week ago or a year ago or 2 years ago, and it would have been easier for you. So that's, encouraging people to use the service is sometimes a bit of a challenge. Good health starts from conception, even preconception. So my vision is that healthy parents and a healthy pregnancy is healthy kids, which lead to healthy adults. And it's important for people to, realise that, things that happen before you're born can affect you throughout your whole life, and there's more and more evidence that that's something in health in general. So if we can get the parents healthy and have the healthy pregnancies and healthy babies, then that's what's going to have a long-term effect on people's life expectancy. I think the good thing about the AMS is there's a lot of services which are all in the one area, so people can come in, they can go to the dentist, and that's another thing. Things like dental health's important for general health. They don't have to go and see someone outside. It's all kind of here, and they can come in, see the doctor about certain problems, but they can go and see the optometrist, they can see, the diabetes nurse, they can see, general kind of antenatal clinics. So there's all of those services are here, and it's a coordinated thing. So you'll often have the same nurses and doctors at different clinics, and, it's just a familiar kind of place for people. The other thing is because it's not a purely a money generating kind of exercise, there's not pressure to churn the patients through to just be able to charge and get the money. It's more you can sit down and take time with patients. So the community's here in the waiting room essentially, so people socialise and see their friends and family members, and the people that work here are often members of the community as well, so they're much more comfortable talking about stuff and and divulging things and approaching and asking for help. The people know the receptionists on there. The good thing about it as well is if people come to the same place, it's easier to deal with and to know when they're sick. If you've seen people before and you have a relationship, then the whole health thing moves more smoothly.
What's good about the AMS is it's a primary health care centre, so there's a lot of services actually available here under the roof, which means that transport is easy for people to access. We bulk bill specialist visits here. There's many specialists that visit the centre, anywhere from antenatal to postnatal care to cardiologists, diabetes specialists, endocrinologists. So a lot of the chronic diseases can actually be managed in under the one roof.
I'm here to help the people that are coming in to see the doctor, and I want to make sure they're welcome. You know, greet them and say, "Cuz, take a seat, you're right, I'll get the nurse for you while you're waiting for the doctor." I like to make them feel welcome and put them at ease. I said, the nurse is coming out, you'll get seen, won't be long. So I like how they come from all over and they say, "Oh, I know your auntie, I know," you know. But the service, they say, "Oh, look, I'm back again, sorry about this." I said, "Don't worry, we're here to help you." You know, so that's what I like. Just a great service. I like working here, meeting other people from all over the place, you know. Because I was sick when I was a kid. My mother had to work, and in the afternoon I had to wait till she comes home and she'd take me to the hospital, and they wouldn't rush me in, and I used to say, "Mum, I'm that sick." And she said, "Never mind, we'll get you in." So I like to give them the service we didn't have when we went to the hospital, especially our people. Yeah, I like to help them with things and make sure they're right. I love the place. I love the service. I love greeting everyone, telling everyone what we've got here, because it's all in the one block.
I know back in the day when we had problems, health problems, we would go to the local medical centre, and being Koori, you were always the last one seen. So whoever walked in the door, you were always pushed to the back and they were seen before you. So as soon as the AMS doors opened, we were the first, and it was just fantastic because we have the best doctors and the best nurses, and if there's anything wrong, they will refer you straight over to RPA and to our big hospitals, and again, you have first class treatment. So anybody that's out there that's scared to come to their AMS, this is what we're set up for. You know, we were set up over 40 years ago and we're going stronger now, and it's just a really nice place to be, and there's so many friendly staff. We have some beautiful young staff and we have a few of the elderly staff, so there's a really nice combination, a nice mixture, a nice balance. But no, just come back and get to know your local AMS, because that's exactly why we're here for, and we're here to give you the best service that you deserve.
Come in here and there's something different every day. You know, sometimes it's helping out a community member, you know, through their health and things like that. It might be staff and organising a staff recognition event, and, you know, enjoying the staff that are here, that have been here for a long time. You know, inviting community in to enjoy our staff events as well. It's every day is like working, not like working, it's work like being as part of a community. So it's really enjoyable, and that's what I enjoy about coming here every day. Our programs have to meet our community needs, and we've got a very finite budget to run our programs. So we have to engage the community to develop the program that's exciting, that people attend and enjoy. All our programs need community input from the get-go. If the community designs a program, it'll meet their needs, they'll enjoy coming, they'll be engaged in their health, which leads to better health outcomes. For our Elders Olympics recently, all our elders who participated in the Olympics had a 715, and it's an annual health assessment to make sure that you've got no chronic conditions, you know, blood workup and all that kind of stuff. And it gives you a baseline for the next year, and you can see if your health is getting better or worse or maintaining and things like that. Our services here are tailored around our communities, to our specific needs. You know, there's a large health equity, gap, and that's one thing that we need to actually tackle front on, and that's what AMSs and community controlled organisations are all about. Recently we've just finished a partnership project with some of our close hospitals, Sydney South West and RPA and Tharawal. We're a partnership project on a smoking cessation program. That's just come to an end, and most of us are actually going alone with our projects now. We're running a quick group, and they run every week for 6 to 7 weeks, and we'll get about 10 people as part of that group. People that may not be ready to quit, so we're giving them information that they need to prepare for quitting, and, you know, nicotine replacement therapy and all the options for smoking cessation. All our programs are specific but general. So they're a specific need but general health outcomes. So you might be about smoking, but you're getting your diabetes knowledge, your healthy food knowledge, physical activity with some of the programs, and then they all link back to our medical clinic as well. So at the end, you attend our program, come back, review with the doctor, and that closes the loop with healthcare.
I would recommend it, highly recommend it, because we have very good doctors here. My doctor at the moment, is spectacular. Absolutely spectacular. And I love him. Hope you don't think anything of that.
I just love the services here. It's, the people are so professional in their work, the doctors and the nurses and stuff like that. And, when your health is, when you get older in life, your health starts to fail. So, you want to come to somewhere where, where they got professional people in their jobs to make you feel better so you can live a longer life. I've been a drinker since I've been 14 and a half years of age, and to come here and look for support. I found a drug and alcohol worker here. Without his support, I wouldn't be sober today, and that's why I'm so grateful. And I'm indebted to the Redfern Aboriginal Medical Service, for giving me that opportunity in life. No, I don't think I would have used mainstream. I think, to come here and have the connection with our people here, with all of the clients and stuff like that, and all the Aboriginal and other workers here. I mean, they make us just feel at ease by coming here and visiting the place and, seeing our doctors. It was so special, a lot of people don't realise, what it means to us to come to an Aboriginal medical service, and, because we sort of feel part of the place because there's so many Aboriginal workers here. And we wouldn't keep coming back here if we didn't keep getting the support that we get here. And we know in our own hearts that mainstream, medical services, they're not as effective as the Aboriginal ones. Yeah, I just want to thank the Aboriginal Redfern Aboriginal Medical Service, for the services that they provided with me, and how they saved my life, and I sort of get in here as much as I can now. Like before in mainstream, I didn't sort of care about myself, but to come back here and see how professional run it is, and I look forward to coming in here nearly every week now, and get myself checked out with being a diabetic, and get my bloods taken, and there's so many other options here. Go and get my eyes checked, But I'm very proud of the service they run here, and the only thing I can say to a lot of the people in Sydney that's using mainstream services, they need to come over here and support the Redfern Aboriginal Medical Service.
I just love the Aboriginal Medical Centre. I would never go anywhere else.
I hope you have enjoyed hearing from our Aboriginal community-controlled health organisations. Everyone knows that we have a long road ahead to close the appalling gap in health outcomes and achieve health equality for Aboriginal and Torres Strait Islander Australians. And while the pace of improvement may appear slow, these improvements have been hard-won and have taken root in the shallow soil of almost continuous policy and budget uncertainty. Critically, they have made a major contribution to meeting the Closing the Gap targets, such as reducing child mortality rates by 66%, and overall mortality rates of Aboriginal and Torres Strait Islander people by 33% over the last 2 decades. Only by improving the health of Aboriginal and Torres Strait Islander people will we be able to tackle other areas of disadvantage. Sick kids can't get to school, and sick adults can't get to work. That's why we are so committed to achieving generational change in the health of our people. As you have seen in this video, generational change will take a sustained effort and will require ongoing coordinated investment and commitment to programs that are working and delivering health outcomes. This will be achievable with Aboriginal health in Aboriginal hands.